Good afternoon, everyone, and welcome to this parallel session, breakout session this afternoon, where we're particularly focusing on the policies for health, a number of recommendations that were made by the summit and by the coalition in 2018, particularly focused in on this area. We have two first-rate speakers to be able to take us through some of the opportunities and challenges, both with very, very comprehensive insights, both at a European level and at a more local level. And we're going to shift things around a little bit to what might be in your program. Focus is particularly still on the two recommendations that we're focused on: how to facilitate multi-stakeholder partnerships with regions and cities, and how to ensure effective EU coordination and leadership. But I think the focus really now needs to shift a little bit. We're in a very, very different position from where we were when those recommendations were written. So the emphasis that we've just discussed as speakers and moderator to really say, how do we move forward from where we are now to be able to do that? So my name is Nick Beatty. You can see that from the slides in the introduction. I'm the moderator for this afternoon's session. I also have the pleasure of being the chair of EUREGA, a European network of regional and local health authorities. So we're bringing that European dimension of health authorities, health organizations who have to deliver this stuff for real on the ground. And that's what I'm hoping that we will tease out through this afternoon, is to go beyond some of the policy statements, general directions that we can hear and that we see, and really focus on learning from some of the evidence and benefits that we've seen in recent months and use that to be able to move forward. We have a starting Slido question for you, which I think is to try and gather the information as to your makeup, which you've all seen. Here's the results. So a pretty even split at the moment between industry, academia, and NGOs and patient organizations. Not much in the way of national government EU institutions, disappointing. A number of medical device industry, healthcare professionals. So some interesting things. Whilst disappointing in one respect, we do have, I think, some of the key perspectives here, both the patient and NGO organization and the academia and research, and we can bring that together and tease that out as we move forward. We've reversed the speaker from what may be in your program. So let me introduce both very briefly. Paola Testori Koji is the special advisor at the National Technology Cluster on Life Sciences in Italy. She's also the former Director General of Health and Consumers in the European Commission, DG Sante. So now has that delightful position of being able to be both poacher and gamekeeper. She can say what went really well in DG Sante, but also now from a national level, how things need to change and move forward. And we have Norman Poppins, Director General, Deputy Director General for Implementation in DG Regio, who can take us through what exactly is happening and his thoughts and insight as to how we need to move forward and accelerate and learn and benefit from some of the things we're working on. So let me move now directly to Paola. The floor is yours to be able to give us your insights and your views.
Thank you, Nick, and thank you to all to have this nice and I hope lively discussion. So I want to start with a brief historical reference, which many people ignore. In 1952, Robert Schuman said that one of the areas which was the most adapted for unification was the fight to epidemics, because epidemics do not know frontiers. And at that time, there was even a French project related to an EU policy for health, and in particular for the management of cross-border epidemics. But that didn't fly at the time. On the other hand, if we look at the EU agricultural policy, we see that the EU has competence to manage epidemics in the area of animal health and can take unilaterally decisions on containment measures, isolation, red zone, vaccination, and any kind of intervention from financial to legal. So, can you imagine, for animal epidemics, it is the EU who act and organize the response, while for human health epidemics, the response lies with national governments. Why? It's clear, because the organization and the provision of health care is financed by the national budget, and the preference of member states and in many states like Italy, the region, on how to best achieve the most effective health care are very diverse, and member states want to keep this responsibility. But in the pandemic situation, the situation is different. Only unified and coordinated we can face the tragedy, and the best example of how a unified answer can work is the coordinated EU strategy on vaccination, which the Commissioner Kyriakides mentioned, where we see that the European Union is able to make an effective deployment of future COVID vaccines. So, do we need a change in the treaty, or what we have is enough? So clearly, the COVID pandemic has uncovered a lot of weaknesses in the US policies, which have not allowed an effective coordination of the member state action, at least at the beginning. At the beginning, every member state was taking action on its own account. So it is clear that we need a greater role, for a US policy. And if we look at our long-term ambition should be to make public health and the fight against pandemics a shared competence of the European Union. At present, it's only a competence of complement and coordinate. So we need to have the ordinary legislative procedures and to provide the Commission with extraordinary powers to coordinate the response to the epidemics. But this is, I would say, a long-term vision, and this is asked, by the European Parliament, by many civil society organizations, and will be one of the themes to be discussed in the Conference of the Future of Europe. But in my personal opinion, this is my personal opinion, and also it's an opinion which I have developed since I am working in the Italian, system, it would be appropriate to have a shared competence specifically with regard to cross-border health threat. Because cross-border, health or emergency health threat is an area where the principle of EU solidarity and equity laid down in the treaty and the rationale of cost effectiveness counterbalance completely the core principle of subsidiarity. In a crisis, we have externalities which need a joint action. We need negotiating power. We need, economy of scale. We need to protect the common public good. So we really need a joint action at European level. But for the management of the public, of the healthcare system, I think we are not yet at the time where we could put this at European level. In the initial phase of the pandemic, the member states, as I said, were operating on their own account. And then the European Commission was able to take an action, a strong action and an effective action, because they have used the current, legal framework. But I believe that, I'm sure that Norman will explain everything which the Commission has done. But I am sure that if the member states were willing to cooperate, there is space to do more, even with this treaty, with this, financial legal framework, for this legal framework. We could give to the European Commission more regulatory and financial powers, and we could ask the European Commission to apply with more effectively, the present instrument. For example, I mentioned few things which I think we could do under the present legal framework. To establish a European health response mechanism, capable of mobilizing human resources, medicine, hospital equipment to be provided to member states. Clearly, this, would imply more funding, more EU funding, more centralized purchases and the establishment of task forces. Second, to strengthen the role of the ECDC in monitoring and risk assessment. But here we would need to have a compulsory requirement for the member states to provide data according to standardized form. Because one of the problems of the collection of data were that they are not standardized. Third, common digital and EL standards at EU level, because we need to have data which are interoperable and which can be exchanged. And fourth, to strengthen the mandate of the European Reference Network in order to have rapid certification at European level of new tests, new methods, new equipment. So I think that there are things which the European Commission can do with the present current legal framework. Now, if I go to the recommendation of the Health Coalition, I believe that you have touched upon many of the most important items. For example, you mentioned collection and sharing of standardized data, partnership with region and cities, and and DG Popes will speak about this. As perspective in policies and stronger coordination in health emergency. Translation of research into innovation and direct therapies. During the COVID in Italy, but in many other member states, we were able to direct implement a protocol, experimental protocol to treat and cure patients. So I think that there are some recommendations where you are highlighting what we need to do more, but there are some other recommendations where you mention things which are already on the good path. For example, for research and innovation, Horizon Europe is already giving a strong answer for promoting research and innovation. Investment in innovation, again, Horizon Europe and the other programs are already looking at investment in innovation. And then also the European health data space, of which I'm sure Roberto Viola will speak in the other session, is one of the areas where the Commission is insisting a lot. So, as a conclusion, I think that we could do more, and the member states should cooperate to do more at European level with the present legal framework, but we should also aim and have the vision to arrive to a shared competence for the management of health emergencies. Thank you.
Thanks, Paolo. Some very, very strong and clear points and some very clear recommendations of what can be done already. We're not going to have questions right now. We're going to have questions as a debate after Norman has spoken. To get you ready now, the questions will be done through the chat bar on the side. We won't be using any voice chat. So if you want to start fielding questions in the sidebar, please do so. Norman, over to you. You can respond directly to Paula or also make your own comments about how successful we're being and what else we need to do.
Thank you, Nick. And let me say I'm pleased to be part of this discussion under the EU Health Summit, because obviously coming from the DG, which manages investment programs in member states, it is important that we agree on how we should proceed from now on, also vis-a-vis the investment into the health term for the medium and long-term development of this sector. And it's not just crisis. But I will start with the crisis, and let me say that I fully agree with Paul. Of course, I think this crisis showed that the more coordinated and also more profound cooperation at the EU level is necessary if we want to tackle those challenges that come from such a health crisis as we had with the COVID pandemics. And to a certain extent, yes, and I fully agree, we had to use the current possibilities under the EU law and under our cooperation with member states to unblock all possible support to the current different parts of our economy, society in this crisis situation. I think we were very successful immediately to rechannel our structural and investment funds, because there we immediately saw that this unused funding, which is still there in current period, we could quickly rechannel to the acute needs of the health sector, but not only the health sector, also to support the impact on, to counterfight the negative impact on our economies, particularly thinking support to the small and medium-sized enterprises and people risking unemployment. So all this we did very well together, of course, with member states, but we started with a very, very fast change of our regulatory framework for current period. And together with member states, we have now reprogrammed more than 100 ERDF, ESF programs in order to alleviate the crisis situation. But that was not all. Of course, we had to work also together on this cooperation on different levels and to try to see that we harmonize our approach, obviously, to how we treat the cross-border traffic, how we also look at the transport sector, the tourism sector, and particularly also how we quickly develop the vaccine. So this cooperation is ongoing. And there has been a good cooperation, but as Paula said, there are certain limits to what can be done at the EU level. We can do a lot, but we still rely heavily on national competences, and also going further, we would look also at the different levels of governance at the member states working together. But I will touch on this in the very end of my speech. So currently, as I said, we have unblocked the funds under the structural funds. We are working hard on all these aspects to develop vaccine, to harmonize our rules at different levels, and this is ongoing. But we need to not forget that this is about building resilience, and this crisis has shown there are gaps, and we need to address those gaps in terms of investment and also regulation. But we should not forget the basics. And this is my plea. When we talk about the crisis, we should remember that the health, we have worked in the field of health from the funds, from the also different other DGs, from different policies. We have been looking at the health sector as a key sector for investment, but also for reform and for change. And this is very important. We know that fighting pandemics is not the only task of the health sector. There are very, very large needs of our citizens, and primarily this equal access to quality health care for everybody and for each problem is very, very important. Now, we have invested heavily into the upgrading our hospital infrastructure, our equipment, also supporting preventive care, reskilling of medical personnel, and so on. I could continue saying that, but it's clear that it has to go hand in hand with a very profound continuation and finalization of different reforms, health reforms in member states. And this is key. We have introduced now a very clear key enabling conditions to unblock further investment under post-2020 regulatory framework. And they are very clear. We need to have a strategic framework for health. There has to be primary equal access granted to everyone, also looking specifically at different marginalized groups and communities. But that has to happen. So as part of it, the very clear mapping, the very clear direction on what are the gaps and where this investment has to flow, something that will be sustainable and maintained in the future, it is extremely important. And of course, we are ready to work with everybody under this umbrella to unblock also potential investment from our programs. Here I'm talking about, of course, structural funds. It is true what also Paula mentioned, that there are also many other financial instruments at EU level, particularly Horizon. We were just talking about the health cluster under Horizon. There are very important amounts foreseen to fund, the research and innovation under health. And if I look at the topics that we try to help everywhere where EU has a value added to have this research and innovation in the field of health. But there we need to think together on the aspect of how we capitalize on the solutions found under those big EU research programs. And there again, I see the link with our program, maybe with EU Health program, which is just being established, that this link and these solutions being mainstream and being taken up in real world between practitioners, between different stakeholders is very important. And sometimes we really don't do that. I mean, I loved what Paula said about the French pandemics and the project we had many years ago. Where are the results? Where is this learning part of this? And this is what we need to do. We need to make sure that from Horizon also we learn, and then we take on and take up these solutions and we roll them out, we mainstream them. And there, of course, our programs can be very, very useful. We also need to make more synergies between different instruments. We are working hard, particularly on health. We're looking at the project calls where we could learn from each other. We have under structural funds around 80 regions who have defined health as a primary field in the field of innovation and research. So they are working there on the ground, and we need to support them. So apart from the fact that we will be supporting health sector under this policy objective more social, we will be investing, we are ready to invest in health under smart specialization strategies, which is support to innovation and research, to support small and medium-sized enterprises linked to health, obviously also to look at the regional aspect. And here it is very, very important what you are saying in your recommendations, the cooperation on different levels, which is regional, urban, local. We have good experience. We have created partnerships for inter-regional cooperation. Now we are working under EU urban agenda on different partnerships which are related to health, where these all levels come together. We need to build on that, and we need to continue supporting that. And in this, of course, the level of involvement of different stakeholders is very important. So even if there is a big role of national government, we need to make sure that this dialogue takes place everywhere in Europe, because in the end, we will succeed in our reforms and subsequently in our investment in achieving efficient results only if there is this ownership at all levels. So again, regional, urban, municipal, local, all the levels have to work with national governments and us to really define solutions for each particular situation. And we are ready to help you. We have a lot of network. We have a lot of good support already ongoing. I already mentioned interregional. It's very important in the light of what has happened also. We know we invest a lot into cross-border cooperation. We know the obstacles. We have specific programs to support this cooperation. It was not enough, obviously. So we need to rethink again, and also in the field of health, to provide solutions for these cross-border communities where, in fact, you have more advantages even to have this better access to health. But for that, obviously, we need cooperation. And for me, the cooperation is the answer for future. It's not working in silos. If we want to fight, COVID or to achieve medium and long-term results, we need to work together. So on this positive note, I would like to finish my speech and, of course, ready to answer any questions that you have. Thank you.
Thank you, Norman. Some really important and I think quite penetrating points there. There was one of the many that really struck home, and also for me tied across a little bit to what Paolo was talking about. We've all seen locally, regionally, nationally, and across the EU, the pace that we have been able to respond to things. Sometimes people may challenge that pace wasn't fast enough, but the one thing is absolutely certain: the pace at which we have been able to respond and move things through in the last 6 months has been so much quicker than we were able to achieve before. And we talk about being able to transfer the learning from Horizon, or being able to transfer new products and technologies into service and into service more rapidly. Is there anything that while we're waiting for questions to come up from the audience, is there anything that either of you want to be able to offer, in the sense that we've moved really, really quickly now? How do we make sure that we keep some of that pace actually going forward? And I would just caveat that with, I think, some of the things that I've seen happen, the pace was probably bordering on dangerous. So I'm not saying we should move all things at the pace we've done in the last 6 months, but equally we cannot afford to return to the slightly pedantry pace that we see before. Do either of you want to comment on that?
I could only add, because coming from one of the DGs with a lot of funding, we have thoughts obviously about also the funding, and there is a new instrument, React-EU, which is exactly meant to bridge also the gap to a certain extent, to use the current programs if we still need more investment into the health systems, but as I said, also into supporting SMEs, remembering that we still need to also have, prepare this recovery as a green recovery. So this green and digital transition, in our minds, it goes together, fighting the crisis effects and bridging the gap to this green and digital transition, which we absolutely need to undergo. I think the crisis also confirmed that. So we have created those instruments, React-EU, Just Transition Fund, and now also we have a new recovery and resilience facility. They are all sort of temporary instruments which are supposed to bridge a gap to the more normal funding instruments in the future, but they are very important for currently. I mean, recovery and resilience facility in terms of amounts is higher than the cohesion policy. And in many countries, it's very important. So I would encourage also to think, and that is linked to reforms. And for health sector, to me, this is key. If we could deploy that money to also unblock some of the necessary reforms, not just to improve resilience of our health systems, but also for a medium and long-term, development. That would be simply excellent, because this facility we have established is also there exactly for that. So I wanted to add that to my normal speeches about the structural and investment funds.
Thanks, Norman. Paula, do you see that now with your national hat on? We've seen the pace of change that is almost unheard of in terms of changing the way we deliver.
Yes, no, for sure. What Norman said is fundamental. We in Italy you know that we have been, I would say, not always a champion of reform. I mean, to put like this, we are always trying, you know, to make our reform more effective. So we will use, you know, the recovery resilience facility to really give, you know, a great, I would say, push, you know, for reform, because clearly the money which are coming with the recovery resilience facility are a lot of money. So this is, you know, the right justification to change and to make reform. So I think that, you know, the European Commission was brilliant in this approach. You know, we give you money, but you have to reform. And I think that with this, I'm confident that also Italy will be able to make a great push in a reform.
Okay, thanks, Paola. I'm nudging the audience here. We haven't got any questions popping up in the sidebar yet. Is anyone desperately typing something in for us? Oh, quiet. Sometimes I wonder whether we've even got the audience on the other side of the line.
Oh, that is the beauty of virtual meetings. You actually don't know. I mean, with Paul, I don't think we see anyone here, just you, Nick. So I hope that there were people listening to us, and we would be happy to say more.
Okay, in the hope that they are there. Synergies was another point that came up. Even within the constraints and the controls that we have between the sort of local, regional, and national level, and if I bring in that element of the regional dimension, and looking beyond recovery into that sort of resilience and moving forward, one of the things that is teasing out is that ability to respond locally, not just in a health context, but recognizing all of the parameters and drivers that influence the health and well-being of our population and efficiency and effectiveness of our services. And that sometimes can be challenging to contemplate across the various boundaries. So when you're looking at environmental conditions, the travel policy, the housing and home policy, any thoughts or views on how that coordination and dialogue can also travel across the boundaries? Okay, I've got some questions coming up on my screen here.
No, of course, I represent DG Regio. It's a regional policy, right? I mean, the reality is that the responsibility or the involvement of regional level depends on the member state. Okay, it's clear that there are different constitutions, different setups. Even when I look at our programs, of course, in big federal countries like Germany, we mostly have regional programs, but there are exceptions. In Austria, where you have federal regions, we run a national program with Austrian, but there are clear, you know, regional authorities are involved. They are part of a setup, so they are the ones who have a say. So it doesn't matter the way that you set up the program, for example, or you set up a directive or a regulation. This depends a lot how the countries are set up, and there are many countries when we discuss whether the level of regions somehow should not be better stimulated, but if there is no, you know, legal provisions for giving regional level and authority, then it's not going to happen. By saying that, I wouldn't say region or not region. I think what I said before is important. Whether it's a region or urban authority, and in many countries they are called differently, you have communes, you have departments, you have different levels. They have to work together according to their responsibility, and there is one for every level of governance. You talk about responding to local needs. It's clear that it falls sometimes to the small local authorities, be it urban or rural, which have to face the difficulty. If they are not part of this bigger ecosystem in health, for example, when they actually can quickly provide, you know, the primary care to their citizens and also emergency care, and then be linked to the bigger hospital somewhere nearby, which is probably not under their responsibility, which is run by region or even a national government. If it's not happening and this cooperation is not there, most likely there's going to be a failure in the system and people will suffer. And this is a point. If we don't ensure that all these levels take their responsibility according to how it's defined in the national rules, work together with us also at the EU level, with the Commission, I don't see any problem in us working directly with regions, with urban authorities. I think we should do it more because we are not going to take over the national responsibility. We are simply looking for the way where EU can provide better value added, working with different actors, and also see what is the impact of our policies when we design something at not just health, but in any other policy. We need to see what will be the impact on the city or rural area. And more we are going to promote this understanding of functional territory, not to contradict, urban versus rural. There is no contradiction, in fact. If we want to succeed in whatever green digital transition or health, we need to make sure that all these territories are seen as functional territories. This is what we will be supporting from our funds and the policy objective, Europe Closer to Citizens. And also currently, I hope that this vision for long-term rural areas, which we are working on together with many DGs involved, that this will also show that from the EU point of view, we have to finally come out of this perception that these areas are against each other. They are together in one big EU, and we need to make sure that this happens. So I hope that we will have this discussion more and more, what is my role rather than what is my role in that larger setup which needs to work together as a totality.
Okay, thanks, Thomas. Paula, any thoughts?
No. To the question, what is added value of regions? I have to say that in Italy, our constitution give the complete competence in terms of healthcare management to the regions. And we have seen some difficulties now. In the COVID emergency, there has been some difficulties because regions which have developed a different healthcare systems, because there are some which concentrate more hospital-centric, others which are more territorial, linked to the territory. We have seen different answers, and unfortunately, there has been a different capacity from the different regions to respond to the emergency. So it's clear that what Norman said, the competence can be regional or local or national, but you need a strong, cooperation and a strong, I would say, capacity of working together in order to bring all the various levels at the same capacity, which in fact it was not the case for Italy in the COVID. I would say in the COVID.
Okay, thank you, Paula. I'm just reading a question that's popped up on the sidebar now. So is the conference for the future of Europe the context in which to discuss EU shared competency on cross-border health threat? Stakeholders should be involved to ensure a wide debate.
No, I think.
Can I ask a question to Norman? You said before that you have 80 regions which have designated health as one of the priority. But in
Under SMART.
Yeah, 8 out of how many in total?
I was referring to smart specialization strategies.
Okay.
And it's actually 76 regions, or smart specialization strategies, because in some cases we still have them at national level for smaller member states, for example. So we have, about 280 or something, smart specialization strategies covering all Europe. So almost 1/4, I would say, is, defining health sector. Of course, different parts of it. It's not just health. Some work on innovative medication, some work on other types of health products. But it's good that they have it already defined. If I look at the priority for health, for current funds, we were investing in about half of the member states in health. So mainstream, maybe 12, 14, and then we have good cross-border investment in some countries. In future, I think probably health will be more visible even in our programs. We have to see, like you say, with the priorities for the funds programs, because we are in a phase of informal dialogue, but we see that obviously under the reprogramming and React EU, health will feature in almost like every program, or at least in most of them, in under structural funds. So we can say that also for post-2020 programs, health will be present. So this is why for me the key is now, to balance this need for emergencies, which we cover under CRE changes and React EU instrument in a certain extent, but then to have also the flow of investment under mainstream. And what you said about recovery and resilience facility is very encouraging, because I think for Italy, particularly for countries like Italy, Spain and others, where large amounts will be under recovery facility, it's very important to use it also for health sector. But there the question is again how it comes together. I saw in one of the slides, it was suggested that we should invest more in the personnel, in the health personnel. Well, we can, to the extent that we can help them for the reskilling, for the protective equipment, but we can't pay salaries. That is not really what the EU does. This is done by national or regional authorities which have that responsibility. So again, there has to be, we cannot, sometimes we have a situation where we build hospitals equipment, but then the question is about this reform having adequate staffing, salaries, which normally should be national or regional level.
Thanks, Thomas. Paula, did that answer your question?
No, but I see that the great part of the answer says that member states not willing to give up their competencies, their sovereignty, which I think is true. Because as normal says, even on the basis of what we have, we could do more, but the point is that there is a certain resistance, from the member states to give up.
Well, health is such a, I think, so close to the, all national debates that we have. I mean, when the discussions before elections take place, it is hard to imagine that, it would go only at the European level. But like you said, I like what you said and what many of you hopefully see. There is a scope also under current legislation at the EU level. There is a scope for improvement.
I'm going to pick up on Owen's comment stroke question, which does touch on the point that Norman, you raised at one point. There's a lot more that we do and continue to need to do beyond responding to the COVID-19 pandemic. So Owen is particularly asking whether the speakers could expand on EU health policy approaches, or indeed national policy approaches, in relation to non-communicable diseases, chronic conditions, other conditions. So a bit more of what the new business as usual might look like.
Maybe
big question.
I haven't worked in DG Santé. I work with DG Santé, and there, this is my eternal question. Can you give me a perfect European health system model with all those compartments and tell me how much in each needs to be invested, and then I will make sure that the member states do that? Well, it's a dream, okay? It's a dream which will never come true. It's complicated because there are so many needs. If you look at the health sector, if we would go idealistically to cover everything, I think no recovery facility or funds would cover together with national funding. I mean, this is huge if we want to live in an ideal world. So we need to define priorities. This is my point. And there are different priorities, I think, in different member states. We need to face that, and we need to address the most burning ones first. But at the EU level, and this is why I mentioned Horizon, we were just discussing what the new Horizon will support. And it's amazing, because I think there we do cover at the EU level support to innovation and research, to rare diseases, to chronic conditions, to psychiatric, to everything. You have funding going everywhere. This is why I stressed, can we link it? Can we learn more? I mean, I don't know what is the experience of the audience, but my feeling is that sometimes we don't enough, learn from solutions found already. be it in Horizon, be it in other region. This is why we have those interregional partnerships. I think we can address everything, and there, of course, when you talk about addressing very specific cases, again, cooperation is important. It's true in Belgium, if you get a rare cancer, sometimes you cannot be operated because there's no specialist. What happens is people are being sent to Germany, you know, to get this. So there has to be, particularly in those cases, a very good European level cooperation between, you know, the hospitals, doctors. I think it's happening, but this is something we should, I think, also promote from the funds in future.
Okay, thanks. Tom Metcalf's comment, how do we ensure that the agenda for change that has developed due to the crisis is maintained over the mid to long term? Well, I think, Norman, you've just picked up and answered on a number of those points, and I'm going to almost flip it around and throw it back out to the audience a little bit. We've heard here already some of the points that at an EU level, how some of that can be moved forward. If anyone in the audience wants to put up some comments or points around, how do we make sure that that happens locally? At that national, regional, and local level, how do you learn from other regions? We heard, I think, the comment that Paula mentioned in terms of one of the slides, that the lack of desire to let go of competency is one of the key barriers to moving forward. There's also a similar proposition that says the lack of exchanging good practice to learn from one region to another still gets in the way. Just because it's been done in location X probably means I don't want to do it in my location Y. So those old barriers can sometimes get in the way. I've got another comment, latest question coming up. So many regional level structures are over-dependent on central level mandates. In particular, Greek government inscribed less funding for primary care in 2021 compared to 2020. How can regional level policy be effective? That is a challenge for many. Paula?
No, can I say something in relation to the question of what the U.S. policy can do more in relation to NCD, chronic condition, and other health conditions? I think that in terms of knowledge and in terms of best practices, the European Commission has done an incredible, effort and incredible results in sharing, knowledge and best practices. The point is that at national level, what was lacking is a budget. Unfortunately, in Italy, but I know also in many other member states, in the recent years, the budget dedicated to health has been reduced. So we have not been able to exploit all the innovation in terms of telemedicine, e-health, innovative therapies. Also, as Norman said, the specialization of health professionals. There has been a lack of budget dedicated to health, who have not been able, to exploit all the knowledge which is available. So for me, it's mainly a problem of level of investment in health, which I hope is changing now. In Italy, it's completely changed. People have realized the mistake which we did in the past by cutting the health budget. And now, all the attention and great part of the recovery fund, and I hope also that Italy will use the MES, so the European Mechanism of Stability, and so now funds will go in the health budget, so we will be able to repair, the problem. But I think, as I said, knowledge, best practice, capacity are there, but we do not have the money to pay for it.
Thank you, Paolo. Money to pay for it. And sometimes I still feel, I ask the question, whether there's the capacity and desire locally to pick up and run with it. There's some lessons that have come out. Some of this was pre-COVID, but also definitely coming out through the pandemic response, where sometimes we have this very, very narrow definition of spend or action in health. And in the IP on our half, for example, that considering of the wider impact in relation to economic investment and innovation, bringing that and factoring it in locally is something that potentially can unlock some of that. So it isn't just about how much do you spend in the health services, but also how much does your economic department, regional or national government, spend in health and health-related technology and health and well-being as something that can factor in. I'm going to ask a question to our technical colleagues, we have a series of Slido questions which occasionally have been popping up and down. Are they in a state yet where we would be able to walk through them and see what the results are?
No, but also, Nick, there is a question asked by Christina. You see here in writing, Christina is asking that now clearly the state budget are concentrating on supporting, people who are losing employment. So how can you make sure that we continue to use EU funds for the healthcare system? I think that, Italy is the best example. Clearly, we are supporting, human resources, but we are always investing in healthcare because now it has become a definitive, must. It is an obligation we have realized. So I have no fear that there will be also a good EU funding for the healthcare system.
Okay, thanks for that. You might be seeing a different set of questions to the one that I've got. But let's pick up any questions.
Our QA, we see that question which Paul read, which actually is a very relevant question because of course we will keep investing in the system, but you're right. In this context of pandemic, this is why I stressed also green digital transition. If we want to go back to the recovery, we should not forget the big objectives and the rationale of our growth strategy, because in the end it will be not just about health, it will be about our economy going back to this sustainable development track, which is somehow lost. And in this chaotic time a little bit, it's true that we might lose a sense of investing into the field of innovation and research because you have to focus on supporting, SMEs, working capital, on introducing wage schemes for unemployed, because the sectors, culture, tourism, massively we have to support through the different wage schemes and SME schemes. And so it's true that we might lose, but this is what also I see is our role, is not to lose it, because we cannot. If we lose that, then really we might be at risk at that the economy keeps failing, and this we cannot afford. So we need to go back to the track where we do support more digital and green, and we don't forget about innovation and research, and also in the health sector. This is why I said it's not just about resilience of health systems against pandemics. This is about really access. This is about covering all the parts of the health system which people need to have access to. And this is a relevant question, and we need to work together. This is why I see also the role of different stakeholders very important to remind. And sometimes I'm worried when I get the request to modify my program, and I will not mention countries, and all I see under health is purchase of face masks. I'm sorry, but to me, maybe it's true that we need to address those very urgent needs. But if it's just that, then I start to get worried, because there might not be that thinking behind that, we need to also invest into something which is more medium term. That's...
Okay, thanks, Thomas. I finally have Christina's question. It's just popped up on my screen rather late. So if you see any others pop up on yours, feel free to introduce them. We've got some points coming up now in terms of how do you ensure a strengthened role for ECDC and DMA. So, Paola, you flagged the need to strengthen ECDC earlier. So 2 comments coming through: becoming a more visible player, more legal powers and extra budget, increased resources, expanded legal mandate. So some consistent themes starting to come up. So resourcing, the mandate. Interestingly, that becoming a more visible player.
I think it is a visible player. I do believe it. ECDC is a visible player. Unfortunately, the ECDC was not able to fulfill completely its mandate on risk assessment and monitoring, because the quality of the data which they receive from the member state was not good enough. So this is the reason why in my initial intervention I said, you need to oblige member states to provide data which are collected, in a uniform way with common format. For example, we do not have the same data on testing of COVID, on mortality rates, because every member state, collect data in a different way. So for me, it's a question of, of legal mandate. It's also a question of resources, but it's a question mainly of legal mandate.
Okay, very, very good point. And it does link, as you say, very strongly to that. If we want to respond efficiently, effectively at scale together, we need to be working on a consistent set of data and information. Otherwise, it becomes very challenging. It doesn't completely stop us, as we've seen, but does become more challenging and to a degree limiting. The other slide of questions that we've had, do we have any of those that we can bring up? So what do regional and local authorities mostly need to be effectively use ESIF funds? Simplification of administrative requirements. Oh, it's moving. It's a moving feast. Let's wait for a couple of people to add their comments. You can see the points that are there. The designation of health as a funding objective. I think you've touched on some of those already. It's a simplification of procedures, better participation of other sectors in the preparation and management of funding programs. Going back to that cross-sectoral engagement.
No, it's
Norman, do you think that your administrative requirements are simple enough?
Well, I'm not. No, we have worked a lot on simplification. Under our previous commissioner, we had established a high-level group on. We have identified certain parts, and under the leadership of Commissioner Ferreira, I have to say that we are progressing very well on certain parts also, and particularly on the new regulatory framework. It will be simpler, but you have to always remember that sometimes, and I see it really, that the regulation is one for everybody. But when you look at the way it's implemented, because we work under shared management, I think personally that gold plating, as we call it, which is adding rules, okay, you can blame the auditors or court of auditors or the perception that everybody will be punished for doing that, but it's not true. There's a lot of gold plating at national levels, regional levels still ongoing, and that's something we will try, and my commissioner wants us to capture, but it's not easy because there are different rules going down to different degrees and levels of governance. And this is what is difficult. So it's not just the commission, because in the field of SME support, with one regulatory requirement, you have the time between the project is submitted and paid, you have from 1 month to 3 years. I'm sorry, this is not the fault of a regulation. This is a fault of the gold plating, okay, which is taking place at program level. We try to deal with it, but okay, we also have certain limitations, okay, but my commissioner is very, very much willing to fight that. Now, with the recovery and resilience facility in the picture now, and basically like we see it can support also health sector quite a lot. There is a very simple rules at the EU level, because there will be specific milestones defined per reform and then per investment, and the disbursement will be linked to these milestones. So it will not be even like we are not requiring the managing authority who will then deal at the project level with public procurement and all those checks. No, it will be a national responsibility. So in fact, it can go very, very simple from the EU point of view, because we would rely on national systems that they would ensure this legality and regularity in a certain extent. So I think you can see that the Commission has thought really hard to simplify access, not just to structural investment funds, but to EU budget as such. But I do hope that it will work, because that will require a lot of, work on different other levels, because the one thing you cannot afford is an EU budget going to things which are irregular or even illegal. I'm not even talking about illegal. I'm talking about irregular, okay? So there is a balance to be found, but we are working on it and hard. There was a question on ESF, ERDF, I mean the two funds under cohesion policy. To me, it should not even be a question. We work together, and we should work together. I mean, health is under the ESF policy objective in future. And ERDF will be part of it, but these funds need to work together in a simple way, under multi-fund programs, under also maybe different programs, but this cooperation between different managing authorities and programs, this is one of the things we are pushing for. And again, we cannot put it in place with shared management, but yes, it needs to happen more.
So more and more removal of the ability locally to blame the European Commission for the administrative challenges that are in the way. I fully agree that gold plating is something that sometimes really causes challenges in the local implementation. Let's have a look see if there's any latest questions. So Roberta, well, how do we make sure this change of mindset is reflected at European level? See the 82% cut the EU for Health program. Program could help not only to fight pandemics, but also strengthen health systems. Any immediate thoughts, speakers, on Roberta's point?
I want to answer to the question, Nick, I want to answer to the question on APIs and pharmaceutical supply chains.
Okay, go for that. Yep.
In Italy, we are developing a project which we want to present under the Recovery and Resilience Fund on reshoring, because it is true we consider that the dependence of Europe to imports from China and India, is dramatic. It has been dramatic. This has been underlined by 2 resolutions of the European Parliament, by the conclusion of the European head of states in November, which they said the European Union should work on diversification of the supply chain, because at present, for certain medicine and certain APIs, so active ingredients, we rely solely on India and China. But the point is that, it is now that I'm studying, because we want to prepare an Italian project, it is also difficult to reshore, so to bring back the production in Europe, because there is a question of economic sustainability. So to produce in Europe, it costs more. It's clear, it costs more because we respect, social laws, environmental laws, which in China and India do not respect. So we need to make sure that there is a balance between the higher prices, of this product and the willingness of the national healthcare system to pay for it. So there is a balance to strike, but it's true that it is one of the priorities.
And I think that reflects some of the sort of rationalizing and rebalancing that we will need to be doing, particularly at the national level. How much do we want to pay for that enhanced resilience?
Yes, clearly.
Yep. I could say something about prevention, because I think prevention in the health investment, which we do, is also a priority. And we have had always massive amounts going to different measures in the health prevention, so I don't see that a problem. If there is a lack of funds in that particular field, I don't think then there is a lack of information or communication problem, because that we have been supporting from our programs already, currently, and also in future. To me, where is a real lack and gaps could be is really in addressing all those different specialized needs, also having, like you say, and probably what Paula says is true, that this is very much also linked to the lack of resources to support, and it's not just, innovative solutions. Sometimes it is also about providing, post-op care at home with adequate nursing staff, with adequate support to psychiatric patients, with adequate support to post-cancer follow-up, and so on. So it's not just prevention. There are large gaps also, I think, on different parts of the health system, depending on which country you look at, again, because it's not equalized at EU level. As I said, there is no one perfect EU model to provide health care to citizens, but there are very good solutions found in many places. And of course, in the end, it will be also about national budget adequately supporting health. We've been saying that, unfortunately, in times of crisis, we have tendencies to cut certain fields of public investment, and in the past it could have been health. Well, I also hope that this crisis showed this is not a sector where we should cut. This is a sector where adequate public investment is needed also at national level. The EU cannot create a health program which will cover. There are certain parts where EU has value added in creating our direct programs such as Horizon or EU for Health, and also shared management programs like in cohesion policy, but it's not going to work alone. EU cannot fund everything on health. This is why I think adequate part of national budgets need to go to health also. It's inevitable, I think.
I think a clear message coming out and hopefully being picked up in our member states. Can I take us on to the next slide of question, because this does touch on that question of prioritization and also touches on promotion prevention. And so can we get the one up? Which of the following areas should be prioritized? Is that possible? If not, we're going to move on to the conscious of time.
I spoke about prioritization already, so
You did. I wanted to see it for the audience.
What we have agreed with our colleagues in DG Santé and also in employment, that when we receive the requests from member states, because they will be coming in, they are already there, on concrete funding in health, we will try to prioritize together that, because there we need a support and expertise, and there I rely, as I said, the work with different stakeholders is very important, because I assume we will get requests to build new hospitals, to renovate existing ones, to do this, to do that. We will have to assess it, okay, in a concrete ecosystem, which is member state, region, local, and there we will be working together. And this is very my strong wish, which I have asked to all our experts and colleagues. Let's try to prioritize and see that we address the real needs first, the most acute needs first, and then we go ahead, because it's hard to prioritize in health. I admit it. I think it's very hard, but we need to do that, because even with the new funds at EU level, I'm afraid that the needs in the health sector are still higher. So, yes.
Yep, it is.
I know I did not answer the question, but yes, prioritization will be one of the principles how we will be looking at the proposals coming in from member states and regions under our programs. We will try to prioritize whether we can.
You'd made the point very well, Norman. I was hoping to try and get the slide of question up to see which priorities our audience actually felt were the most important.
Yeah, that would help me, definitely. No,
yeah. I'm not sure that we will. I'm conscious we've only got a few minutes left. So heads up for the audience. We're going to skip through the slide of questions, answer if you can. But the final one is actually one which will form a word cloud for us in terms of forming that summary of what it is, describing in one word you think that this breakout session has achieved, rather than would like to achieve, in terms of moving forward. Whilst that is coming up, let me attempt rather challengingly to draw together what has been a very, very wide-ranging, comprehensive and well-informed and well-articulated discussion from Paolo and Norman. We've covered a huge range of territory, but there are some themes that I think emerged for me. Everyone is in this together. This is not about the EU being able to solve things. It has to be around that collaboration. The first words have popped up. Being able to work at all the levels and recognizing that those different competencies at the level are all part of the picture. There is a clear theme around, we've been through a history of under-resourcing health. That's a very, very blunt statement, but collectively under-resourcing health. That is recognized, it's very evident. It's how do we respond to that? How do we move forward to address that going forward? There were some clear messages for us from Paolo in terms of we can already do things in the context of what's available in terms of the rules now. So let's not use the need to move to a new environment as a barrier to prevent us moving. We can already change and move to a better state, particularly around strengthening the role of ECDC, particularly around being able to share and use data and information more effectively. And Norman has given us a very, very clear indication of how he and DG Regio and the European Commission overall are shaping and blending the funds, the instruments, the programs to allow us at a national and a regional level to be able to tap into those and to be able to use them effectively. But we need to step up to that table and play our part in making sure that we shape and move forward. So they are some of the many headlines. The key one that still came out for me is we need to continue to talk. Dialogue, not having the dialogue between the various levels, across the various boundaries, cross borders, is one of the barriers which is preventing progress in many areas. I'm watching the word cloud as it pops up. It's moving quite rapidly, although the numbers are quite small, so one or two changes can very rapidly shape what comes up. But I think the points that are being raised there are valid ones. So coordination effectively at all levels, shared competency, the common priorities, the one we talked about just before, and the need to continue a dialogue in a focused and constructive way. I would sort of expand the dialogue. It's not just about talking in a way that delivers change and delivers the progress that we want to deliver. I'm going to draw us to a close at that point. I'd like to thank Paola and Norman particularly for the input that you've given us. It has been outstanding in terms of the breadth of knowledge you bring, as well as the insight as to where we can go forward. Thank you to the audience for the questions that have come in and to our colleagues in the technical support. I think it is now time that we switch from this parallel session and we rejoin one of the plenary sessions. So in the normal scheme of things, we'd all now be clapping. So feel free to clap or raise your hands as a form of clapping if you wish to thank our speakers. And I will see you all in the main session in a few minutes. So Norman, Paola, thank you very much, and we will see you again.
Thank you, Nick. Thank you, Norman. Ciao, bye-bye.
Thank you, Nick and Paola. Thank you to all.
Ciao, ciao, bye-bye.
Bye.